when you come to a new field about which you know nothing, that you browse the literature, talk to people if you can, attend lectures if you can, and listen for the totem words, the words which either consciously or unconsciously people in the field give special meaning. And I find that if you can figure out what those totem words are and then go away and figure out what they mean, you'll find out at least one of the things that's very important to people in the field that they don't say is important to them necessarily, but they give it importance by continually using these totem words or continually emphasizing them. For instance, last week I went to grand rounds at our regional hospital, and there was a cardiologist giving a talk. And he was giving a talk on the pharmaceutical management of cardiac patients who had circulatory problems, problems with blockages, problems with leakages. He would go through a series of example patients. This patient comes in with these symptoms. What do? We immediately stent this patient. How do we drug this patient for the stent? We're going to use this compound and we're going to use this compound, but we're going to stay away from that compound because it can cause bleeding, and we don't want bleeding. Now, this patient has got a partially occluded artery and is in a lot of pain. We're going to give this patient warfarin because we need to dissolve that clot and prevent it from growing. However, we're not going to give this patient these other two drugs because they can lead to bleeding even worse than warfarin can lead to bleeding. We give combinations of these drugs because it reduces bleeding. Bleeding this, bleeding that. What I came away from, not knowing really that very much about how to treat cardiac patients, was that if we can generalize from just this one talk, what's most important is to keep the patient from bleeding no matter what you do. And so if I was given a new drug and asked to predict whether or not it was going to be a success, the first thing I'd look at is whether it causes uncontrolled bleeding or not, what the likelihood is, how it can be combined with other things, all from a standpoint of, does it cause bleeding? Now, that doesn't give you the answer to how that new drug is going to do, but it gives you a lead into it so that you can then begin to understand how things are going on. So I'd say look for the totem words. When you're reading an article, look for the words that the author of the article seems to come back to over and over, and then start by figuring out what those words mean.